Now. Oh, thank you. Well, welcome. My name is Stephanie Chong, and I am one of the board of directors for Leading Age DC. And this is one of our Lunch and Learn series. I'm delighted. I am a social worker myself, so delighted to have Miss Latrice Herndon here today from the Board of Social Work, who's going to talk about what the board does, some of the changes to the new CEU certification and so forth. So I'm going to be quiet and turn it over to you, Latrice, and thank you so much for being here today.
Absolutely. I literally was tapping into my team this morning. I first want to say thanks to everybody because anytime I talk to a group, I tap in with my team at the last minute and say, is there anything you all want me to tell people based on what you've been seeing over the past maybe 30, 60, 90 days? So good afternoon, everyone. I'm Latrice Herndon. I'm Executive Director for Allied and Behavioral Health Boards here at DC Health. Currently, I'm Executive Director for the Board of Social Work, the Board of Professional Counseling, the Board of Psychology, and the newly formed Board of Rehabilitative Therapies. And that is the former boards of audiology and speech language pathology, the Board of Occupational Therapy, and the Board of Physical Therapy, all combined into one. So those boards were sunset. Those boards were sunset last year because we're in a whole new year now. So last year, those boards were sunset. And in September, we had the very first meeting of the newly combined Board of Rehabilitative Therapy. So I went from initially 7 boards to 6 boards to now 4 boards because this team used to also have the Board of Long-Term Care Administration, which was absorbed by the Board of Nursing. And then the Board of Professional Counseling absorbed the Board of Marriage and Family Therapy. So a lot of changes have been going on. There is one word you're going to hear me use or acronym today, which is HORA, H-O-R-A, which is the Health Occupations Revision Act. I encourage everyone to poke around in it. It is the one document that supersedes all board regulations because it is the governance of healthcare professionals in the District of Columbia, regardless of profession. And then your regulations fall under that. So in determining, I know you all wanted me to talk about CEUs, but I figured I would take this opportunity to give a lot of information that is either unknown, and we figure it's unknown because of a lot of questions we get asked through email or in person. And then there's things that, we think everyone needs to know. First thing I'm going to start with, where is DC Health located? DC Health moved 2 years ago. Actually, it'll be 2 years next month. A lot of people are still sending things to our old address. We used to be on North Capitol Street, but we are now at 2201 Shannon Place Southeast. We had our first functional business day in this building on February 26, 2024. So we are coming up on 2 years in this building. It is a beautiful building. It's kind of, if you know MLK Avenue in DC and you know where the Big Chair is, we're literally the street behind the Big Chair. And so it's a nice, beautiful building that we're in, our processing center, where you can get either vital records, birth certificates, and things of that nature. And then also, if you have an issue with licensing, it's all handled on our first floor. So I want to start there so that everyone knows. I also want to talk to everyone about how to contact us if you need anything. And I'm going to talk about this at the beginning and at the end of this presentation, if that's okay, or this chat. And how you contact us if you have any concerns or issues. The best way to reach us is through the board email box, which is DC, D like David, C like Charlie, BO, B like boy, O like Oscar, SW for social work at dc.gov. That is the board email box. We have someone in that box every single day. I cannot stress enough that that is the best way to make contact, because if you email a member of staff and they happen to not be in that day, or people get sick or take off, whatever the case may be, your email will sit somewhere in perpetuity until they come back, right? So we want to make sure that we are addressing your concerns as urgently and immediately as possible. And the best way to do that is to email the right place. We've been finding, I'm not sure why people are doing this, but they are emailing like DC Health, Ask DC Health, one of those like agency emails. And so then they're saying, no one answered my email, nobody answered my email. I've been emailing. And it's because when you email that, there are a lot of different hands it has to go through to sort to figure out where it's supposed to go. So it could be 2, 3 days, it could be 2, 3 weeks before it actually gets to the appropriate team because it's in a larger box for the agency. If you are a social worker, if you want to be a social worker, and you have questions about anything dealing with your license, your application, dcbosw@dc.gov. If you find you haven't gotten a response to that box, then you email me. I'm next. And my email address is Latrice, Latrice, .Herndon, HERN like Nancy, D like David, ON like Nancy, @dc.gov. Okay. So now that we've covered how to contact, when to contact, I always say start with us first. Start with that social work box, then come to me. I am a huge fan of chain of command and taking the proper steps. Usually, if someone just calls me out the blue, the first thing I say is, "Hey, did you send this to the board email box first?" Because I want to make sure that the team was given an opportunity to address your concerns before they come to me. So I'm just respectfully asking that everyone, if you have a concern, if you have a question, send it there, because a lot of times what happens is the staff might look at it and say, you know what, you need to talk to the executive director about that, and they'll forward the email to me. That is the whole how to deal with issues and concerns. So the contact information is very, very, very important. One other thing to remember is that if you ever need to come into the building for any reason, please check the doh.dc.gov website to see the times of the processing center on the day that you want to come. The processing center is not open the entire duration of the time that the agency is open. The agency hours are 8:15 to 4:45. The processing center will open from like 9 to 2 or 9 to 1. It depends on the day of the week, and they have their own days and times that they open. So I always tell people go to doh.dc.gov to see what the processing center hours are for the particular day you're thinking of coming. If you feel like you need to come to DC Health, I also encourage you to email the board box and try to make an appointment to come here with a member of my staff. The reason for that is if you come on a day where, let's say there's a board meeting and the staff is in the board meeting, you're going to be sitting and waiting and upset. And I like to make things as easy as possible for people so that they can get their issues addressed timely, because I think if you're already upset about something, having to wait probably makes you a little more anxious or upset about the situation. So these are like best practices to address any concerns. So now we're going to jump into some other changes that have happened here at DC Health. The first one that is creating a lot of, I'm not going to call it ruckus, but we'll just say a lot of celebration is what I'm going to call it, because I think it's what you call it and not what it actually is. But renewal by birth month and birth year. So for all the professions that fall under DC Health, all the healthcare professions, we are now doing license renewals by birth month and birth year. Previously, each license type had what I consider a bucket renewal, meaning all the social workers renewed every 2 years. I think they were every 2 years, the odd year, last day in July is when they expired, okay? That is no more. As each profession over the last year and a half, almost 2 years, has entered into their last, what we call bucket renewal, they have gone into their respective renewal by birth date and birth year. And the way that works is now your license will renew on the last day of the month that you were born. During the even year, if you were born in an even year, during the odd year, if you were born in the odd year. So you and your friend are not going to be the same. If you are someone who manages groups of health professionals, whether they're social workers or other professionals, I have definitely been encouraging individuals who manage those spaces and have to manage making sure everyone maintains their licensure, you're going to have to come up with a system that works, because potentially you could be having someone expire every month, because we're doing odd year, even year, and birth month on top of that. Okay. So you could have a bunch of people born in July. Some are going to expire this year. Some are going to expire next year based on the year they're born in. So you're going to really have to figure out what type of tracking system is going to work best for your organization to track that information. As you enter into your bucket renewal, some people did not get a full 2 years. And it's simply because we had to go into it was a transition. So some people didn't get a full 2 years. Some people got the full 2 years. If you did not get the full 2 years, all the boards voted, and a notice actually went out on August 4th of 2024 to all licensees. And it went out via email. So I would say, if you're saying, I didn't get that, check your email. And when I say check your email, don't check the email you use, check the email that you have on file with DC Health. That's also very important. Whatever email we have on file for you in our database in your portal profile is the email address it would have gone to. If you feel a need to change that email address, please email the board email box, that DCBOSW, requesting that your email address be updated. But there was a notification sent out to all licensees on August 4th, 2024, letting them know that all the boards had voted and agreed before the summer ended to allow those who did not receive 2 years upon their next renewal, they would only have to produce 50% of the required CEUs. And that information is also on the board website as well. I know our board website, I've got no words, but scroll all the way down and there is a section saying continuing education, and it's like a blurb at the bottom of that section. So that information is there. No, we're not prorating any fees. There's no fees being refunded. And for everyone who says, oh, it's not fair, it's not fair, we hear you. But here's what I tell people. If you didn't get your initial license at the end of a renewal bucket cycle, you didn't get a full 2 years on your license initially anyway. So based on, if we're talking social work, if you were not getting your license during the months of May, June, or July, the year of social work renewals, you didn't get a full 2 years on your license. If you didn't get that license until December, you were only getting what was left of that 2-year cycle. So when people say, oh, I didn't get a full 2 years, I paid and it's not fair. When you first got your license, you didn't get it either. But what we're basically doing is having the board, we had the boards to vote. Each board voted to allow the profession to only have to produce 50% of the CEUs. Now, here's what we say about that. You only have to produce 50% of the board required CEUs. The public health priorities and the LGBTQ plus, you have to produce your full CEUs for that. The reason why is because those were not imposed by the board. The LGBTQ plus was imposed by the mayor. The public health priorities was done by the agency director. Okay, so you have to do 50% of the other stuff, but you still have to do your public health priorities and your LGBTQ plus CEUs. Okay. Next thing I want to discuss. Let's just talk about CE requirements since we're already on, renewal cycles. So CE requirements. For those who receive, and just so we are always clear, this is only for your first renewal post the new renewal process. So if you didn't get the full 2 years when you got into the renewal process, when you have to renew, because some people only got a year, some people got a year and a half, some people got 2 months shy of 2 years, whatever it is. Once you do that renewal, you'll have your full 2 years, and then you're responsible for the full CEs as before, okay? So the full CEs are 40 hours of approved continuing education units. That includes 6 hours of ethics that must be done face-to-face or live interactive webinar. Live interactive webinar would mean I am the CE teacher and we're live right now. You can count that. But if I were a recording, cannot count. Okay, so basically asynchronous. So live interactive webinar or live face-to-face. No pre-recorded courses are accepted. 2 hours have to be LGBTQ plus training. That can be an online pre-recorded course. And 4 of the total required continuing education shall be in public health priorities. And if you go to our board website, you can see what the public health priorities are for you to be able to choose which areas you would like to do those in. Only 12 hours out of the total 40 hours required can be pre-recorded or asynchronous. Okay, let's talk about that. Only 12 hours of the total 40. So you got to have 40 total, and you got to have all these breakdowns. In all those breakdowns, only 12 of the hours can be pre-recorded. Everything else has to be live or face-to-face, live webinar or face-to-face, okay? Individuals who receive less than 2 years on their license while entering new renewal, we talked about this, only required to produce 50% of the required CEUs, and you're still required to produce the public health priorities and the LGBTQ plus CEUs. I'm going to pause there, and I'm going to ask if there are any questions. And I guess I should look at the chat to see if anybody put anything in there.
The only question in the chat is, could you put your email address in the chat?
I sure can.
That'd be great.
You know what else I'm going to put in the chat after I do that?
Mm-hmm.
Let me make sure I spell my name right. I'm also going to put the social work email box in the chat.
Great, thank you.
And I'm also going to put the blurb about the CEUs in the chat.
Oh, thank you so much. That's really helpful.
Okay. Great. So let me just check off what we've covered so far. Okay. The next thing I would like to talk about is a new pathway for licensure. So social work has consumed a large amount of our time over the past, I would say, 2 years. There has been, I'm sure some of you know, I'm sure all of you probably know at this point, ASWB came out with the information regarding disparities in their exam. And that basically showed that Black and Brown test takers and test takers whose first language is not English were passing at significantly lower rates than their white counterparts. The information came out. A coalition emerged that wanted jurisdictions to drop the requirement of the exam to become licensed. This started probably about 2, maybe 3 years ago, because we were under a different director when everything started. There were a lot of meetings that were held about it. And ultimately now under the new director, there is a pathway you can take to become licensed as a licensed graduate social worker that does not require the ASWB exam. Currently, right now, it is listed as an emergency rulemaking. I think that the plan is to make it permanent. I don't know if that's going to happen, but it is still under the guise of an emergency rulemaking. And it is only for the licensed graduate social worker license. The way it works is it is a pathway called licensure by education. So currently there are 2 ways to be licensed. You have licensure by endorsement and licensure by examination, as with all the other social work types in the district. For LGSWs, you now have licensure via education. What that basically means is that an individual can apply so long as they have the MSW from an approved institution. They take their criminal background check, produce their transcripts, and all the other requirements that we typically would ask for someone applying for licensure via examination. But they don't have to have the exam. They will be issued a license, and their license is issued for a full 2 years. Because what they will be able to do is work under supervision, of course, to obtain, I believe it's 1,500 hours. And then when they get to the point that they have to renew, they have to show that they have either accumulated these 1,500 hours under supervision to maintain that license, or show that they have passed the examination. For those of you who are LICSWs, so clinical social workers, or independent social workers, LISWs, you can supervise these individuals, which means depending on where you work, you may start to see an influx of individuals who have this license via the education pathway. On the surface, you will not know the difference between who has taken the exam versus who hasn't taken the exam unless you ask the person. The license will look exactly the same as someone who's taking the exam. Okay. They will have a social work license. It will show as a social work license. The caveat is that when that person who took the education pathway goes to renew their license, if they do not show, because it's basically going to be something we have the supervisors to fill out to send on their behalf when they're renewing. If we do not receive it, if they do not show that they've passed the exam, they will not renew that license, which means they will not be able to keep it. So I think it's important to keep that at the back of your head, because if you take someone under your wing now and they don't do the hours and they don't pass the exam, they will not have the license, and then they'll probably have to just go the regular examination route. If they do the required things for the renewal, the hours, or pass the exam. Let's take the hours piece. If they do the hours, they renew the license, they've shown the proof of the hours, now they have the license permanently. So in essence, the initial 2 years on that license are the competency period that is taking the place of the exam. Once they produced the evidence upon renewal, they have the license. They don't have to produce any other hours. They're just the same as an LG who took the exam. If another jurisdiction wants to take that, they can. We don't have control over that in the district. If Maryland says, hey, fine, we'll take it even though you didn't take the exam, that's Maryland's business. If they don't, we don't have any control over that. So it's also important to know that we know jurisdictions may or may not take it, but it's up to another jurisdiction if they take it or not. I'm going to pause there to see if there are any questions about and we've probably already licensed at this point. I think through this pathway, over 200 individuals have been licensed via this pathway. Sometimes what we're seeing is an individual may apply via examination, and then they may say, you know what, let me switch over. I still want to take the exam, but let me switch over. And they'll do that. And then, if they pass the test, fine. If they don't, they'll just continue to work and take the re-exam and keep moving through the process. But I think it's important for everyone to be aware that you're going to have an influx. And this was basically to address the growing need for social workers in various spaces, and being able to, which is why it's an emergency rulemaking currently, to address those needs. The next thing I want to address kind of piggybacks on that, and how that LG pathway came to be. It literally started in a board meeting. The Board of Social Work meets, this is a shameless plug, but the Board of Social Work meets the fourth Monday of every month. Make sure I'm giving you the right Monday. 1, 2, 3. Yes, the fourth Monday of every month is when the Board of Social Work meets. Typically is a 10 o'clock a.m. meeting. It is virtual. So I encourage everyone. I'm not saying you got to come to all of them. What I usually recommend is if you work with other individuals, I know you guys typically have staff meetings, group meetings, team meetings, whatever the case may be, designate somebody to come. Have a rotating thing where you designate someone to come every month and bring the information back to the larger group. A group came to a board meeting saying, hey, ASWB came out with this information and we think the board needs to do something to change it. That's literally where it all started about 2.5, 3 years ago. And there was a lot of back and forth. There were a lot of meetings. The previous director was like, no, we need a competency measure. The board at the time said, no, we got a new director. They came back. They went up. That director said, okay, let's see what we can do. I encourage everyone to be active. I know we are busy. We are living in a crazy world. We're living in crazy times. You all are in a profession that was just deemed, not a profession or not professional. I hear you. I hear you. I hear the PTs. I hear the nurses from next door. They're yelling about it. The best thing I can say is presence in your profession actually matters. In the moment when you're in the trenches, it may not feel like it. It feels like, oh, I'm fighting so hard for these things. But 3 years in the making, and here we are with a pathway. Okay. And there's potentially a pathway similar that will be coming for the independent social workers as well, that basically creates a pathway for these current LGs via education to obtain the independent social worker license the same way. So board meetings, virtual. I'm not saying come to all of them. This board does not meet during the month of December, and it does not meet, and none of the boards meet during the month of August. Also, if you are a DC resident and you've been licensed for at least 3 years and you are interested in serving on the board, please go to the mayor's, it's called MOTA, MOTA. It's the mayor's office on talents and appointments. And any board that exists in the District of Columbia, if there are vacancies there, they exist. The Board of Social Work, we just actually we'll have 2 new board members joining for our next meeting which is actually this coming Monday. But we'll also have 1 board member, possibly the 2 that are already there. So come Monday, we'll have a board of 4. But I also understand that there are term limits. So even though we're bringing on 2 new people, by the end of the summer, the other 2 people will be gone. So we'll be back to 2 people. So I encourage you, if you are interested in serving on the board, to submit an application via the MONA website so that they can start to, look at the processes and things of that nature. Your voice matters for your profession. Your voice matters for your profession. Maintaining quorum. It also gets the work done. When people apply for a license or if someone is complained about that is a licensee, these are things that go before the board. If it's an application that has to go before the board, if we don't have quorum, the board can't review it. I can't make a decision because it's something the board has to do. So sometimes things will wait an extra month. And we don't want to delay applications because of that. So we want to make sure that we keep a full board. And so I am always doing this shameless plug where I'm championing for people to be a part of the process. I know everybody is busy. I know you're overworked, underpaid, and extremely tired. I overstand, but we need you all to tap into your profession. And if I give you an example, and this one really drove it home for professional counseling. The Board of Rehabilitative Therapies that I was speaking to you all about is 3 boards that were combined into one. And one of the reasons that was given by council when it was combined was failure to meet quorum for a certain number of years for each of those 3 individual boards. And that happens when you don't have enough board members to fully be on that board. And when it was announced that merge was going to happen, a lot of the organizations from those 3 professions, national and district, started to reach out. We hadn't heard from them the entire time I had been in my role, hadn't heard from them until this happened. And I'm like, had you been there before, this probably would not have happened. And so I think they're all fighting to get their boards back. But here we are now. We've got the Board of Rehabilitative Therapies. I think the other thing that also goes into that is compacts, and how a lot of professionals will say, we want a compact, we want a compact, we want a compact. And I always tell people, you have to be cognizant of the fact that sometimes when you get something, it may cost you something. And so for those 3 boards that merged, one of them is actually in a compact, and it's physical therapy. Well, what that means is that that's less discipline that comes before the board, because the only discipline that will come before the board will be those licensed in the district, and not necessarily those who hold the compact privilege, right? And so that means your meetings are shorter. So it's almost like, well, why do you need a separate meeting? You have this compact. Your compact is, the home state will take care of it and things like that. And in the district, less than a third of licensees in a district are actually district residents, right? So that puts us in a whole different sphere. So now, whereas physical therapy, when they were independent, pre-compact, their board meetings would last for hours. During the compact, once they got the compact, it wasn't lasting that long. We probably get in and out, open session and executive session, hour and a half tops. Whereas before, we'd be 4 hours locked in, 5 hours sometimes locked in. And so OT heard that, and then they were like, "Wait, maybe we don't want a compact because Then it was like for them, it was you. You're not having your meetings scheduled. You don't maintain quorum. You don't have enough people on your board, right? And so this happens when the individuals in the profession are not a part of their process. And then everyone tries to figure out why it happened. So this is me saying, hey, look at what's happened, and here's how we got here. You don't want to see that happen to your profession. Social work's a little too big for that to happen, but they're not merging you with any other boards. It's just too big. But there are other things that could be seen. And you want to make sure that if a decision is going to be made about your profession, that your voice is heard. I always tell people if you can't make it, we post the meeting minutes to the board website. And so you can always go and see, what was on the agenda, what was spoken about. You have a question, you want to make a comment, you want a statement read during the open session, you can actually email that to the board box and still be a part of the process that way. And I encourage you all to do that. I encourage you to attend the board meetings when you can. You don't have to come here. They're all virtual. The link is on the board website as well. I'll pull up the board website and drop the link in the chat in a little bit. But just being a part of that process, hearing what's going on in your profession, and also watch council hearings. If you're licensed in a district and you really want to know outside of the board meetings what may be coming to the board, Christina Henderson is the chairwoman over the Committee on Health. I love the fact that she uses YouTube. When she streams, she does not just use the council website. And the reason I love that is because on the council website, if you go to it and you can't, if let's say you just chime in and you're like, okay, I can't finish the rest. I'll watch it when they post the recording. It takes them a couple days to watch the recording. But on YouTube, as soon as it's done, it's there. So if you didn't get a chance, you could literally go home at night. If you got a smart TV, pull up YouTube and go to Christina Henderson's YouTube page and pull up that hearing and give it a listen and hear the things that they're talking about, because that's also going to give you a bit of a lens into what's going on or what could potentially be coming down the pipe, not just in healthcare, but specifically in your profession. The last thing I'm going to talk about today is what we're here for. What is my staff here for? What am I here for? What is the board here for? And that is public protection. I always like to tell people that while we're here to license people, which is yourselves, professionals, we're also here to protect the public. And so, but also understanding that you are also the public. You may be a licensed professional, but you are also a consumer of services provided by other licensed professionals. You each have an MD. You may see a nurse. You may see a physical therapist. You may see a professional counselor. You may see a psychologist. You may see a massage therapist. Each and every one of you consume services from other licensed professionals. And here's what I'm going to say to that. We have found that we don't think people know how to file a complaint if they have a problem with a licensed professional. And so because I look at you all not as just professionals, but also consumers of other professions, I want to talk to you all about the complaint process at DC Health. Typically, if someone goes somewhere and they have a problem with the service they receive from a licensed professional, they may ask for a manager. If they're at a hospital, they may ask for the patient advocate. And your complaint will be born and die right there. Most people do not know that you can make your complaint there, but you can also file a complaint against the licensed professional to DC Health if they are licensed in the District of Columbia. I'm also going to drop a link for that in a second once I pull up the board website in the chat, because the way you would do that is you would file a complaint against that professional using an online form. You can submit that form to that online portal, or you can email that form to the board email box to file your complaint. And when I say the board email box, if you're a social worker and you're like, hey, I only know the social work email box, you can send it there. We'll get it to where it needs to be. Once you tell us who the person is, what profession they have their license in, we can get it there. If you have a problem with multiple professionals, I remember a couple years back, I had someone say, I went to a hospital in DC and, I had a care team. The nurse did this, but then the PT did that, and the doctor didn't do this. The facility, this was, there were wires up hanging out the wall in my room. There are two complaint forms you fill out. Well, actually, more than two. So you can fill out one complaint form for the actual people that you want to complain about that are licensed. But then because it's a hospital, and we at DC Health have a division that oversees hospitals in DC, there's a complaint form for facilities. And so you would submit both, and then your complaint would be taken care of. I'm sure some of you have maybe been seen. If you saw someone and you felt like you did not get a great experience in the hospital, or you felt like things were not what they needed to be, you could essentially send both complaint forms to the social work box. We'll get them to where they need to go. But we want to make sure that we always look at you all, not as just professionals, but as consumers. If you are DC residents, we look at you as our constituents. You are residents of the District of Columbia, and we're here for the public, and you're members of the public. You just so happen to be licensed professionals as well. But even licensed professionals see professionals. So I'm going to drop some chats in, and I will open up for any questions anyone has. I'll drop some links in the chat in a second.
Great, thank you. This was so helpful and thorough. I learned way more than I even imagined, and I hope others feel the same. If you have any questions, if you don't want to be on the recording, you can put them in the chat. Otherwise, if you'd like to unmute yourself or turn on your camera and ask a question, feel free to do so.
Hello.
Hi.
Hello, this is Leonetta Latrice. I have a question about the pathways. I just wanted to get clarity. I know
Yes,
you
ma'am.
said something about the 15 hours within the 2 years after the person receives their receives the license. They, I just want to get clarity. Do they have to do the exam after the 15 hours, or there's an option, the 15 hours or the exam?
Either or.
Okay, that's what I want to get clarity on.
Before the completion of the 2 years.
Okay,
Yes,
yeah,
ma'am.
thank
So
you.
they have to produce either or when they're going to renew it.
Okay,
If it's produced, they'll be able to renew it, and then they don't have to produce anything else for their renewals going forward. If they
okay,
don't produce it, they do not keep that license.
got it. Thank you.
Absolutely. Great question.
Questions? Hi, Marla.
Hi, everybody.
Hi.
My apologies. I came in very late, and so you may have already said this, so
No worries.
I am so sorry. Did you talk at all about continuing education requirements for the
Yes, ma'am.
social work license?
Yes, ma'am. I dropped it in the chat.
Okay, great. Thank you so much.
Absolutely. Absolutely. Thank you for joining still.
Sorry, so late. The day
Better late
got
than
away
never.
from me.
We're also recording this program, Marla, so we'll
Okay,
share this with all of our social workers in the email chain.
great.
And so you can go back and watch it, and I'll see if we can download the chat and put some of the highlights in an email, so to make it easy to find.
Hi, Latrice. This is Leonetta again. I do have a question because I do have a staff who did do the pathways, but I realized that they came with their license and the license is way less than a year. It,
Yes.
okay, they're
We're
going to
gonna,
be
yeah, we're making an adjustment for that.
okay.
So what we realized was that because the education pathway individuals have to have the full 2 years to give them time to get the hours, there are a couple hundred people that we have to make the adjustment for. They're trying to figure out a way to where we don't have to do it manually right now. So theirs will be updated. So while it may not reflect it now, there will be an update for those.
Okay, thank you.
Absolutely.
Any other questions? No? Well, Latrice, thank you so much for your time and your
Absolutely.
very clear and thorough explanation. I didn't realize all the ins and outs that go on behind the scenes. So thank you for that.
Oh,
And a call to action to anyone on the call or who's watching the recording, if you want to join the Board of Social Work Board
yes.
of
Oh, let me
Directors.
get that website. Hold on. Let me put that one up there too.
Okay, that'd be great. They're certainly looking for it, and your point about your profession needs your voice is so well taken, and we have a tendency as social workers to advocate for everyone else. But we can't be good advocates if we don't advocate for our profession and ourselves as well. So a good reminder to support our profession. And if you haven't gotten a chance to look at the chat, you'll find lots of great resources, including contact information for the Board of Social Work, Latrice's email address, where to file a complaint against a licensed professional, and the Office on Talents and Appointments is that's for the board, correct?
Yes, correct.
Okay,
Correct.
fantastic. And I see
And
great
just,
presentation and information.
yeah, thank you. And just so everyone is, last week I did a presentation with Catholic Charities for those individuals who will be pursuing the Certified Addiction Counselor credential. And, you know, I can't say enough to professionals, especially now, about getting involved in the process. Because when we were going through their requirements and, like, you know, we're looking at, it's a presentation I do every year. And I said, I am not giving you guys a PowerPoint this year because the staff has been complaining about things they see coming through with the applications. And I said, I think we need to address this, right? And so one of the things we saw was that people were not getting supervision from the right individuals. And so what we found when that was happening was that someone's done these hours, probably paid someone to supervise them. You've spent your money for probably a year and some change. Your hours aren't going to count. The person's not going to give you your money back. Everybody's going to get a fine, you know, all these different things. And so one person said, well, you know, I don't understand why to supervise us, someone has to have all of this. Like, they should just be a CAC. Why do they have to have an MD and a CAC, or be a social worker plus have the CAC or whatever? And I said, well, how many of you have ever been to a board meeting? And literally I got crickets. And it's like, that's why I say now is the time. There's so much changing in healthcare by the day. You gotta find a time to stay tapped into your profession. You gotta. There's shortages across the board for all healthcare professionals. I don't have to tell you all as social workers what your numbers look like in terms of burnout, people just saying, you know what, I can't anymore. And then how difficult it is to get individuals to come into the profession who actually want to be clinicians in the profession. Because we know a lot of people get the MSW to do other things, but they're not getting it to per se come in and actually do the social work. Okay. And when you look at how tough that is, you want to stay tapped in because you don't want changes to be happening. And then you're trying to figure out how we got here. The other thing is it would be great for some of you to tap in because for this current fiscal year, all the boards I have want to do some challenges where we're tapping into the youth. We're in a space right now where in this country, everybody wants to be an influencer. You want to be a TikTok star or a social media influencer. Nobody here is saying, I want to be a social worker. That kids are not saying, I want to be a nurse. They're not saying, I want to be a physical therapist. They're not saying, I want to be a speech language pathologist or I want to be an audiologist. They're not saying this. They're not saying, I want to be a professional counselor or I want to be a psychologist. They want to be an influencer. And so initially, some of the boards had spoken about going into high schools. And I said, do you think that's too late? That was the question I posed. Do you think high school's too late? Because they're already tapped in. Do you think we need to get them earlier? So now we're looking at brainstorming ways to go into middle schools, to start talking to middle school students about these professions, but not just talk to them about them. We want to do a lot of brainstorming in how, and we're open to anyone is on this call. If you have a friend that has a friend that has a friend, and you've got some great ideas of how we can do this, please email myself, email the board box. We love to hear your ideas. A lot of it comes to looking at this generation, whether they're middle school or high school. And one of the things I told everybody is I feel like we have to work backwards. We have to literally say, this is what it looks like in the end, and then get them excited about that and work them backwards. And we know social work is not always a pretty field, but it's gonna reach somebody. Who is your, if you had to say, hey, like let's show them something that someone with a license in social work can do. Like I want something licensed. I don't want to look at the people who get the MSW, and like I have a lot of colleagues here that have MSWs. They are not licensed social workers, right? But they have the MSW, but they got it to do other types of things. I want them to hear the MSWs who are out here, the PhDs who are out here, who are actually doing the clinical social work, who are doing in the field, seeing clients, the different types of clients that you're seeing. It's not necessarily that you're working with foster children. It's not necessarily that you're working with the homeless population. You could actually be doing therapy sessions. You could be doing ABA. You could be doing, but they don't know. And so this is the year where we are choosing to enlighten individuals, enlighten the youth on what these professions actually do, and get them excited about healthcare career fields. Because if not, all of us on this call are in trouble because we're aging. And the youth that's in high school and middle school now are going to be the group that's going to be our caregivers. And right now, we're seeing in this country a large influx of international licensees who want to become licensed in the US, because enough youth in the US are not going into healthcare career fields. So if you've got ideas, if we can partner together to get the word out, to do some collaborations, to whatever it is we can do. I need youth excited about healthcare. I need them excited. I've got a 6-year-old that wants to be a veterinarian. I'm like, you don't want to be a people doctor? You don't want to. I'm literally trying to sway him away from the animals right now, but he's so obsessed with the animals. And it is, and I'm kind of trying to just, go with it while, I always say we've got some JCO issues going on in my house right now, because he has his toy giraffe and he has an actual human surgical doll, and he's always doing surgery on them side by side. And I'm like, this is a major issue here. But I kind of let it go. I need kids excited about every single healthcare career field that there is. We need more social workers. We need more professional counselors. We need more psychologists. We need them. Especially in a district, I never thought we would be in a space where we need more speech language pathologists. If you got a kid in any public school system right now, whether it's DC, Maryland, Virginia, or even in California, because California is posting virtual positions. They don't care where you are in America. They want you to be licensed in California and see the high school students who need the speech language pathology services. We are at an all-time shortage for healthcare professions. And I am really trying to work with every board and collaborate with as many organizations as we can to get the youth riled up about these professions.
Wow. Well, thank you so much, Latrice. Your passion for our work is so palpable. So we really appreciate having you on our side and
absolutely
your time today. And we will share this recording with our colleagues, and really appreciate this very informative program.
Absolutely. And I'm here. You can shoot me an email. I'm still getting the emails from last week's presentation. If it's something that comes to mind after we get off the call, please feel free to reach out, whether it's to myself directly or to the board email box. We're here. We are here.
Thank you all so very much for being here today, and have a great rest of the day. Stay warm.
Thank you.
Take care.
Thank
Bye.
you.